Hair loss is the total or partial loss of hair in one of the areas of the body where hair usually grows, especially the area on the top of the head. The life cycle of one hair in the scalp goes through 3 stages, noting that not all hair goes through the same stages at the same time, namely, the growth phase of the hair begins to appear at this stage, and the age of the hair at this stage varies depending on the location of the hair. So the eyebrow hair, for example, remains at this stage for about 6 months, while the scalp hair can stay for 6 years at this stage, and the hair length increases every month at a rate of about 1 centimeter. This stage begins after the end of the growth phase, where the hair growth stops and the length remains the same, and the hair cells in it turn into dead cells, and the area of the skin papillae turns into a collection of ineffective cells and lasts for 2 to 3 weeks. The hair in the area of the skin papillae enter the resting phase, and the hair length remains constant, lasting from 1 to 3 months. After the end of the previous 3 stages, the hair falls out automatically, and this type of loss is natural hair loss, or the action of tensile factors during washing or styling hair, and the hair follicle enters a rest period for several weeks to start a new cycle of growth of a new hair from the same follicle of growth of a new hair. The hair that we see stuck on the comb, hairbrush, or on the tile floor of the bathing place is that hair that has expired its natural shelf life, and the normal daily rate of the number of hair that falls out naturally due to the end of its life cycle ranges from 50 to 100 hairs of scalp hair. And this rate of loss does not affect the overall view of the scalp hair, and this rate of loss does not affect the overall view of the scalp. An average of 100,000 hairs remain on the scalp every day, and a number of hairs enter the growth phase daily at the same rate as the natural loss, and therefore, the scalp maintains the normal number of hairs in it. Anagen hair loss, in which sudden hair loss occurs sharply and quickly, and the patient's complaint is accompanied by a short hair length and not increasing its length for long periods. Empty hair pores appear in the area of loss, an example of which is hair loss after protein. Telogen hair loss. It is an acute loss after a period of 3 months of pregnancy or taking medications that cause it, and it begins in the form of severe thinning of the hair followed by loss, especially in the area of the tips of the front of the scalp, as well as examples of hair loss after childbirth and hair loss during lactation. Hair loss associated with skin diseases. Hair loss occurs only in areas prone to skin disease. Scar hair loss is in the form of hair loss in a scar-forming area due to several reasons. Hereditary hormonal baldness. It is one of the causes of hair loss for men, and it appears in men in the form of gradual hair loss that increases with age after adulthood, starting from the front area of the scalp, accompanied by severe thinning of the hair and expansion in the area of hair, difference in women, especially the elderly layered. Alopecia areata. Excessive hair loss occurs in specific spots with an average diameter of 1 cm, most often due to autoimmune diseases. Hair loss in children. This type occurs for several reasons and may be accompanied by itching, redness of the skin and scaly edges of the affected area, and if it occurs, you should see a doctor to find out the cause associated with this loss. The problem of head hair loss is a very common problem, and it is not limited to men only. Hair loss can occur in women, men, children, and it is also normal for some kind of natural loss to occur when aging. The causes of hair loss vary, and most often the treatment of this problem lies mainly through treating the cause of it, and proper diagnosis, finding out the causes of hair loss, treating hormonal disorders, adjusting the ratio of hormones in the body, in most cases, leads to the return of vitality and activity to the processes of hair growth of the scalp, and thus treating hair loss and getting rid of it. According to the American Academy of Dermatology, hair loss occurs due to a number of reasons, as the causes of hair loss may include genetic, psychological, hormonal factors, or concurrent medical conditions, and the following are common causes of hair loss. Hair loss due to hormonal disorders. Changes in the ratios of some hormones in the body cause temporary problems in hair growth and hair loss for several reasons, including hair loss after childbirth, during lactation, taking hormonal contraceptive drugs, or after stopping taking them for long periods, or disorders in which the percentage of male testosterone increases, and others. Hair loss due to psychological pressure. Stress and psychological pressure is one of the causes of sudden or slow hair loss, and perhaps the good thing is that hair loss due to stress does not usually need treatment, but the hair returns to its previous state with the disappearance of the psychological causes of hair loss. Hair loss due to medications. Profuse hair loss is a common side effect of many medications. Most often medications cause temporary hair loss that goes away as soon as the dosage of the drug is adjusted or you stop taking it. Hair loss caused by malnutrition. Healthy hair growth needs to eat sufficient amounts of proteins containing essential amino acids. Hair also needs iron and other groups of minerals and vitamins, similar to body tissues that are characterized by continuous growth. Malnutrition or following ill-considered weight loss diets leads to negative effects on hair and its growth naturally, and malnutrition is one of the causes of frequent hair loss. Hair loss due to skin diseases. Some skin diseases lead to hair loss as one of its complications, such as tinea capitis, psoriatic alopecia, psoriatic dermatitis of the scalp. Hair loss due to the use of harmful chemical preparations. The use of cosmetic treatments for hair is one of the causes of abundant hair loss. Those chemicals or physical effects of the means used in hairstyling, beautification, and the manufacture of various hairstyles may lead to hair loss, as resorting to types of chemical dyes. The use of chemicals or physical means used to the structure of the hair. The brittleness, falling. Other causes of hair loss. There are several other causes and risk factors for hair loss, the most important of which are viral or bacterial infection of the scalp such as syphilis, autoimmune diseases such as systemic lupus erythematosus, sudden weight loss. It is a form of physical trauma that can lead to hair loss. Aging. With age, it is normal for a person to lose his hair more often than during youth. Genetic factors. It is believed that androgenic hormonal baldness is usually a genetic disease. Fever. The U.S. Food and Drug Administration has granted some pharmaceutical products a permit for use in the treatment of hair loss for men, and these products are as follows: minoxidil. It is available in the form of a solution or foaming liquid, applied to the scalp twice a day, and has an effective effect in stimulating hair growth and preventing hair loss. It can be used without consulting a doctor, and it must be used for 4 to 6 months to see results. Heredity. This choice of treatment is one of the options that need to wait at least a year for it to bear fruit and show its result in the treatment of hair loss in men. Hair transplantation is one of the common operations to treat hair loss in men, and there are 2 types of operations that are the most common: follicular unit transplantation. It is the old known method, and it is done by removing part of the scalp skin located at the back of the head where there is a lot of hair in this part, and replanting these follicles in areas that suffer from hair loss. Direct follicles. In areas that suffer from hair loss, direct follicle transplantation. It should be noted that hair transplantation is a surgical operation and has some side effects such as infections and the occurrence of scarring in the skin, as well as the prices for surgery may vary from place to place and depending on the doctor. Laser therapy can be used in the treatment of hair loss in men, as it works to reduce inflammation in the follicles, which helps to treat some types of hair loss, such as alopecia areata. This technique involves taking a sample of the patient's blood, placing it in a centrifuge to be able to separate the platelets and extract them from the blood, and then inject it into certain areas of the patient's scalp. The platelets promote the healing of damaged hair follicles, which helps to treat hair loss. Quitting smoking. In a 2020 study of about 1,000 people, it was found that the majority of smokers suffer from hair loss. So quitting smoking may help in the treatment of hair loss for men. Scalp massage. In a 2016 study done on Japanese men who massaged the scalp for 4 minutes every day for 24 weeks, it was found that the massage stimulated the growth of follicles and made the month more intense. Follow a balanced diet, especially when the diet includes a set of vegetables, whole grains, some trans fats, while reducing sugars. Stay away from stress. Psychological stress can cause hair loss in men, so various ways to overcome stress should be followed, such as exercising regularly, doing yoga and meditation exercises, and getting enough sleep. The use of natural oils. The use of many natural oils helps to treat hair loss for men, including, for example, peppermint oil, which improves hair growth. Rosemary oil promotes blood supply to the scalp by stimulating blood circulation. Coconut, castor, and olive oil. Saw palmetto. It is one of the plants that contain small fruits in the form of a berry, and in a study conducted in 2020, I found a relationship between saw palmetto and hair growth with few side effects. Biotin. Biotin is a vitamin that is naturally found in some foods such as nuts, eggs, sweet potatoes, onions, and oats. Onion juice. In a 2014 study conducted using onion juice as a topical treatment for alopecia areata patients, it was found that onion juice led to an increase in the speed and intensity of hair growth compared to using tap water only. Chrysanthemum flower. It is called the false chrysanthemum flower, and it is a sunflower, and it is one of the herbs known for its great ability to increase hair growth and thicken it. And there are many studies conducted on animals using the extract of this flower, and the results were amazing as it helped hair growth better than drug treatment. Green tea. As in a study conducted in 2005 on mice, monitored the amount of polyphenols contained in green tea, it was found that green tea is a natural and effective remedy in the treatment of hair loss in men. But research has not been completed to study the effectiveness on humans. Hibiscus. Hibiscus is a plant that has a history and a good reputation in India for its use in hair growth. In a 2003 study on some mice, it was found that hibiscus has significant positive effects on hair follicles.